What up, guys? IFBB Pro and online coach Morgan Macdonald. Today we're just going to talk a little bit about PEDs and blood work and what blood work you should do to kind of keep yourself safe when you're using PEDs. So I'm a firm believer that anyone who is just a recreational PED user, you just like to go to the gym, you live the lifestyle, eat a good diet, you train hard, but you want to enhance things. I personally don't really feel there's anything, necessary more than just testosterone. I think you can get fantastic results by increasing your testosterone levels with exogenous testosterone. Testosterone is naturally occurring in the body, so the body knows exactly what to do with it. The only precaution you would have to take there is obviously managing estrogen, because anytime you take testosterone, your testosterone levels go up, your estrogen is going to want to go up as well, because your body's going to try to keep everything balanced. And that can also obviously lead to some, negative side effects like gynecomastia, acne, hair loss, like all these types of things that can come from, having elevated testosterone and elevated estrogen levels. As far as a recreational user goes, if you're really serious, you could dabble in some other mild compounds like primobolan, masteron. These do have some benefits, especially masteron, in terms of helping with aromatization with the estrogen going up. So you might be able to actually include something like masteron with your test to use less AIs. AIs being aromatization inhibitors like Arimidex or Aromazin, because these AIs are actually some of the most harmful things that bodybuilders take because of the effect that they have on your lipids, like your cholesterol. So you really want to, not overuse those. So actually by adding in some of these other compounds, like I said, you can limit the use of those. So yeah, recreational guys, test Primo, Masteron, a little bit of AI if you need it. Growth hormone, it could be another safe additive in small doses. Growth hormone just has benefits almost to anybody, helps with your hair, your nails, your skin, obviously with muscle recovery, muscle growth. If that's something that's affordable to you, because it's not cheap, could be another thing to add in. When we get into like the physique athlete space, and especially people trying to achieve pro status and beyond, it's not to say that more, powerful or stronger compounds are necessary, but they certainly do help, right? So this is when we get into things like, your boldinones, equipoise, nandrolones, your MPP, DECA, Tren. These are really powerful, really effective drugs, but they come with stronger side effects, and that's something you need to be prepared to deal with. Not just physical, not just health-wise, but even mental, especially those nandrolones like the Tren and the MPP. These types of things are really popular in bodybuilding, but again, when you're taking super high doses of this stuff, you can get like mental side effects like depression, anxiety, crazy mood swings. So these are all things that you need to have the discipline to manage, and it does come with experience. My recommendation to anybody that wants to get into, being a physique athlete would be to get a coach that really knows what they're doing and has a lot of experience with this stuff, that has walked the walk, hopefully a pro themselves, or has coached like numerous pros that have actually helped them do this. Then you're in good hands, and if anything does go wrong side effect wise, you have someone to kind of bounce these things off that can help you deal with it, right? As far as staying healthy when you do these things, blood work is number one, right? You need to be prepared to get your blood work done 3 to 4 times a year, in my opinion, if you're going to be running cycles, especially the physique athlete cycles we were talking about, those like harder drugs. It's not only the drugs themselves, but obviously you're trying to gain muscle, and the more muscle you gain, the more weight you gain, especially when you're someone like myself who's walking around over 300 pounds, most of the time. Things can go wrong with your health, so what do you need to look out for? I would say the top 2 would probably be your kidney and liver numbers. So kidney being like your creatinine and your EGFR. You also want to get like a urine sample done to see if there's any like blood in your urine, protein in your urine, because if these numbers are off, then your kidneys aren't functioning like they should be. What can lead to kidney damage is mostly high blood pressure, right? So a lot of times taking steroids increases your red blood cell count, and that can increase your blood pressure. So to be honest, a lot of bodybuilders, especially at my level, take precautionary blood pressure medication just so that when we're running these cycles, our blood pressure stays in normal ranges to avoid kidney damage, right? Kidney damage is something that a lot of bodybuilders run into. They run into those issues, right? And they have to be resolved, or, God forbid they get kidney failure and they have to get dialysis or something like that. So that's a big one. Liver function obviously is huge too. Your liver kind of acts like a filter for your body, right? So anything you put in it got to get filtered through your liver before it's going to go into your bloodstream and actually do what it needs to do. So you want to be monitoring your liver enzymes, your AST and your ALT. Get a liver ultrasound every now and then just to make sure you're not getting too much fat build up on your liver, especially if you're bulking and putting on a lot of size and weight. You want to keep those in check. Cholesterol is another big one, like I mentioned earlier about the AIs. So cholesterol, your HDL, LDL, total cholesterol. HDL is one that takes a big hit usually when taking cycles. A lot of times for guys it drops down low. and this increases your risk for like heart disease, heart attacks, these types of things. So that's another big one. Just like your hemoglobin as well, right? Like we mentioned, blood pressure. Like if you're running super high hemoglobin, super high RBCs, it's something that you need to look out for. That's why a lot of us give blood 2 to 3 times a year. Obviously, giving blood is a good thing because you're helping people, but obviously a blood dump is going to help lower your hemoglobin, take some pressure off your body, and help lower your blood pressure as well. Other than that, what comes to mind is probably blood sugar. Again, this is going to be more like an off-season setting when you're, really pounding food and trying to get bigger and grow. Carbs are super high. You want to make sure your A1C is in check, so that's going to be your blood glucose level average over a 3-month span. You want to keep that below 6.0, and with the blood glucose, same thing. You want to keep that in 6.0 or below. When these things start to trend higher, probably going to need to take in some type of supplement to help that, whether that's insulin or metformin. Those are 2 good things to use. Or you might just be eating too much carbs that your body is not processing, and then there's leftover, which is ultimately going to make you fat and insulin resistant, which is where this issue comes from, right? So other than getting like echocardiograms done and even like brain MRIs, these types of things, I think these are all things that should be done periodically throughout someone's bodybuilding career, because when you're taking high doses of GH and high doses of steroids for prolonged periods of time, all these things can be affected, and they can definitely have detrimental effects if you're not, looking after yourself and looking into these things and working with a doctor to help you. So, yeah, guys, that's my advice when it comes to PED and bodybuilding. So, hope that helps. Stay safe.